You should never give up hope. There's always new advancements, new treatments, new drugs. So there's always something out there, clinical trials. You just need to believe in your doctor, need to believe in yourself, and you need to have the courage to continue.
Nathaniel Buganim is a medical oncologist at the McGill University Health Center. He has received specialty training in breast cancer with a focus on bone metastasis, breast cancer which has spread to the bones.
The good news in breast cancer is that we're moving away from chemotherapy. Chemotherapy is what everybody thinks of when we think of treatment of cancer. We think of losing our hair, nausea, vomiting. So we've been moving away from that to more targeted treatments that have less side effects, that are a lot of times oral, and that are very effective because they only destroy the cancer cells. And this has changed a lot the quality of life, which is the main goal that we want to achieve, but also it has been, a huge revolution in breast cancer over time.
Francine Musso is a patient of Dr. Buganim.
My name is Francine Musso. I'm 37 years old. I'm a wife, a mother of 2 young boys, and I'm a metastatic breast cancer patient.
Metastatic breast cancer, sometimes called advanced or stage 4 breast cancer, is breast cancer that has spread to distant parts of the body, such as the lungs, liver, bones, or brain. In Canada, about 5% of new breast cancers are metastatic when they are diagnosed, and 20 to 30% of women who are first diagnosed with early-stage breast cancer will go on to develop metastatic breast cancer.
Back in 2014, I had an accident. I hurt my back. I ended up in emergency at the hospital, and doing x-rays, they found that there were some marks on the bones in my back. After many MRIs and scans and x-rays, they told me that I had tumors on my spine.
Like any cancer, when you announce to someone that they have metastatic cancer, right away it's a big shock. Emotionally, it's very draining. There's a lot of thoughts that go through. Don't forget, these are women. Some of them are very young. Some have families. Some have dependents on them. So it changes your life, and emotionally it's a roller coaster, and they think they're dying tomorrow.
I sort of knew what metastatic breast cancer was. I knew that when you got to that point, that means it spread to other areas, but I didn't really know the full knowledge of the word.
Right away, it's fear, worry, anxiety, but that changes as soon as a plan is made and as soon as they understand what breast cancer really is. It's not a definite life sentence, and it's not imminent. And there's a lot of treatments.
When I saw Dr. Buganim the first time, and I'll always remember what he said, he told me, yes, you have cancer, but this is not a death sentence. Just think of it as a chronic disease, something that can be treated long term. So that was very hopeful.
When treating breast cancer, the main goal is quality of life. We want patients to be able to return to work, go to school, take care of their kids, do what everybody does, be normal.
I really can't complain about my quality of life. I go about doing my daily activities like I did before. My back is so much better. I don't have the pain that I did in the beginning. So I'm able to do activities with my children. I'm able to do my own activities. I like to ski. I'm able to exercise. So I'm really enjoying life and living it at its fullest.
Apart from quality of life, we also want them to live as long as possible. And in order to achieve that, we need to control the cancer. That make it stable or slow the progression or even shrink it in order to achieve that kind of goal.
Knowing the hormone receptor and HER2 gene status of a breast cancer is important because this information can guide treatment decisions.
Receptors on cancer cells can be present. They can have estrogen or progesterone receptors, and that's really important because it tells us how the cancer wants to grow. And it grows in the presence of estrogen. And by knowing that, we're able to target those receptors by blocking them so that they don't see the estrogen, or by removing the estrogen from the body in order to starve the cancer cell. There's also the HER2 gene, which when it's overexpressed is able to cause the cancer to be more aggressive and grow rapidly. And we have treatments that target that as well. So those are quite important to characterize the cancer in order to have the right treatment for the cancer.
When Dr. Buganim met me, he told me that he had good news with my receptors. I was very relieved to have this type of diagnosis, HER2 negative and ER and PR positive. Since it was hormonal, I was able to take this treatment in pill form. So I didn't need to do chemo for a very long time.
Hormone positive, HER2 negative breast cancer is treated with anti-hormones, such as letrozole, anastrozole, or exemestane. We also have tamoxifen, which is a very old treatment and still very effective, which blocks the estrogen to bind to the receptor. And there's newer medications that are now available for Canadians, such as CDK4/6 inhibitors and mTOR inhibitors. CDK4/6 inhibitors have changed the treatment of breast cancer enormously. For the last 10 years, what we've had is anti-hormones or hormone blockers, until the mTOR inhibitors that were in about 2012. Since then, we've had nothing. The CDK4/6 is a very novel way of treating breast cancer. It's combined with anti-hormones and it's capable of slowing the progression and treating patients and keeping them stable for a very long time. This is one of the biggest development in hormone-positive breast cancer in the last 10 years.
It's very encouraging to hear all these different advancements for metastatic breast cancer. It gives a lot of women hope. It gives me hope that, the initial diagnosis is not the end, but there's other ways of dealing with it, other treatments, and it's just very promising.
We're able to control cancers better. We're able to have less toxicity to patients. Not only that, if I had to think 5 years ago, I would say the best I would try to hope for breast cancer, for metastatic breast cancer, would be to control the disease and make it be more of a chronic disease. But today, with all the advancements in gene therapy and gene editing and immunotherapy, in more targeted treatments that make the body destroy the cancer, I wouldn't be surprised if we find a cure one day for breast cancer.
Francine is hopeful to inspire other women sharing her journey.
Knowing that my treatment has been very successful, I'm very hopeful for what there is to come, for the future, for myself and for other women as well. You never know how strong you are until strong is the only option you have.
To learn more about recent treatment options, as well as ongoing research within metastatic breast cancer, please speak with your medical oncology team.